This video will demonstrate the two-step method for a PICC dressing change, which should be performed every 7 days or as needed. To begin, you will first review the VAD care and maintenance protocol, as well as facility policies for the PICC dressing change. You will then perform hand hygiene and gather all necessary supplies. Next, you will introduce yourself to the patient and verify the patient with 2 identifiers. Ensure that you explain the procedure to the patient and assess their comfort level. Begin by pulling the curtains or door for privacy, cleaning the bedside table, and raising it to proper working height. Once that is completed, perform hand hygiene once again. Then begin opening the dressing tray while maintaining a sterile field. Add extra supplies to the sterile field and place necessary waste in the garbage. Next, put on your clean gloves and place a sterile drape under the patient's arm. Instruct the patient to face away from the PICC arm and position the patient's arm for easy access to the dressing. Inspect the catheter insertion site and surrounding skin. Inspect for complications such as pain or erythema, palpate for tenderness, and notify the physician or PICC RN for any complications. Begin removing the top portion of the old dressing by pulling it down, around, and away from all the lumens. Pull past the securement device only. Ensure that you do not remove all the way in order to keep the insertion site secure. Pull the adhesive strip from the securement device off the lumen. Then gently remove the securement device from the skin. Begin cleansing the skin with a chlorhexidine swab using multi-directional friction for a minimum of 30 seconds and allow it to dry. Once dry, grab the new securement device and secure the lumen into the new device. Next, place the securement device on the skin by removing the backing and pulling the wings to either side and adhering to the skin. Make sure to monitor skin integrity and change position if needed from the previous. Gently remove and loosen the dressing just before the insertion site. Now it is time to remove your gloves, clean your hands, and don new sterile gloves. Using the sterile forceps, begin to remove the remainder of the dressing in the direction of the insertion site. Once the PICC line is exposed, use a sterile gloved finger of one of your hands to hold and secure the line in place, while the other hand removes and discards the old dressing. Make sure to secure properly so that the line does not migrate out. Once the dressing is removed, assess and measure external catheter length. This should be measured at least 24 hours in acute care and with each home visit or at least every 7 days. There are 2 methods for measuring external length. You can measure from the insertion site to the integrated wings on the catheter hub, or you can measure from the insertion site to the last visible centimeter line, or 0 if present. If external measurement migrates to 3 centimeters or greater, then contact your local PICC team. You will then begin to cleanse the catheter site and surrounding skin once again with multi-directional friction for a minimum of 30 seconds with chlorhexidine. Ensure that the skin is completely dry in order to avoid complications with skin irritation before applying the dressing. Also ensure to take precautions to secure the line and not to dislodge it with the swab. Once clean, apply a new dressing, ensuring that the insertion site is in the transparent window for visual assessment and that the securement device is covered. Then date and sign the dressing label. Prime the new needleless caps, then replace the old caps with appropriate aseptic technique. Assess all of the PICC lumens for patency and flush the line with 10 mL of normal saline. First, inject 1 to 2 mL of normal saline and then aspirate slowly, assessing for blood return in the lumen. Continue with a push-pause flushing technique to empty the syringe. Never forcibly flush a PICC with any size syringe, and lock with heparin per agency protocol if required, and ensure the clamps are closed if present. Clean up your supplies and dispose of equipment appropriately. Ensure prior to leaving the patient's bedside that the patient is safe. This includes putting bed rails up as needed and ensuring the bed is in the lowest position possible. Finish off the procedure by documenting relevant information.